An important responsibility you will have when you are working to assist survivors of a disaster or crisis is your responsibility to care for yourself. If you fail to plan for your own self-care, you will fail to be as effective in your responder role as you could be. Dr. Charles Figley, a leading expert in the study of traumatic stress and responder self-care, has said, "There is a cost to caring. We professionals who are paid to listen to the stories of fear, pain, and suffering of others may feel ourselves similar fear, pain, and suffering because we care." Without planning for and practicing self-care, disaster responders are highly vulnerable to compassion fatigue. Figley describes compassion fatigue as the emotional residue of exposure to working with the suffering, particularly those suffering from the consequences of traumatic events. There are strategies you can employ to prepare yourself as a responder before, during, and after a disaster or crisis. This preparation will help you to avoid the consequences of compassion fatigue. Realize that as a crisis or disaster responder, you will need to practice flexibility. Know that in a crisis or disaster, you will probably encounter conditions such as limited access to limited resources and an atmosphere of chaos. There may also be environmental pollution as the result of a disaster event and other ongoing threats to your safety. Additionally, the realities governing the disaster and the operational aspects of a response may create circumstances that present challenges that you would not face in ordinary circumstances. During a crisis response or a disaster deployment, you should maintain an attitude of flexibility, patience, and tolerance towards the survivors and fellow responders who are all affected by the situation. Be prepared to practice self-monitoring so you remain aware of your own needs for rest and renewal. You should plan to have regular check-ins with colleagues, family members, and friends who can help you process what you are feeling and experiencing. Schedule brief relaxation or stress management breaks for basic body care and refreshment throughout the day to minimize accumulated stress. Learn to accept the limits of your role and the fact that you will not be able to change everything for the people you are helping. Following a crisis or disaster deployment, expect to experience a period of reintegration back into your normal day-to-day life. This will not be automatic. Pay attention to cues from your friends and family that you are becoming or remain too involved or focused on the disaster or crisis situation. Recognize that the trauma you have witnessed will probably change your worldview. Make an intentional effort to rekindle close personal relationships and involvement in healthy pre-deployment activities. Following a crisis or disaster deployment, be gentle with yourself. Participate in formal recovery activities such as provider support groups. Increase your leisure activities for a while. Pay attention to your health and nutrition. Get all the sleep you need. Make time for self-reflection through journaling or meditation. Be open to receiving love and support from others. And find things to make you laugh.